My name is TERAWHARANGI TREVALIA Mangu. I'm from the North Island of New Zealand, from Te Awamatu, and I am 60 years old. Now, previous to this, I had the other hip and knee operation, and that was 10 years ago, and I've been suffering with the pain of the other hip for that long. Unable to walk without crutches, can't bend, couldn't do my shoes up, couldn't put socks on, couldn't go. What I love, my most favourite hobby is to swim.
So yeah, just not being able to do everyday things like every other person does. Just sweeping the floor it's been hard work. I heard about Wockhardt Hospital through my daughter. She'd seen the trouble I was going through trying to get into hospital in New Zealand. One, I couldn't get into the public system. I couldn't get into private systems because they couldn't get a doctor. My daughter mentioned India, so I started looking and found Wockhardt Hospital and Dr. Mudit. I finished work on Friday. We flew here Saturday, got to Mumbai on Sunday afternoon, was picked up, came straight to the hospital, and then started going through the x-rays and everything, other procedures that they needed to do for us.
I'm Dr. Mudit Khanna, consultant in the Department of Orthopaedics and Trauma at Wockhardt Hospitals, South Mumbai. We realized that she needed both a total hip replacement and a total knee replacement for the way her hip and knee were affected. As per plan, we had no unexpected events during the surgery. She made a steady recovery with the knee replacement as well. She was up and about the same day in the evening after the replacement surgery.
Absolutely a good decision to come to Wockhardt Hospital and actually to meet Dr. Mudit Khanna. I would not have changed anything. I feel a lot more confident even after the first day after operation. So I've got a lot of plans about doing cooking, stuff that I couldn't do before, cooking, swimming, can't wait to get back to swimming, walking just to be able to, because I used to love walking. So excited, it's like the whole world is just, here we go.
She's able to take quite a few steps without the help of a walker, holding somebody's hand, as she was sharing her experiences with our team here. She's all set to fly back to New Zealand in the next couple of days.